15 overdose prevention sites across Ontario have been approved to operate under a new model. The provincial government has just announced this, but it's a decision activists are calling a disaster because 6 existing safe injection sites, including the works, haven't been given the green light.
The new model has an enormous amount of bureaucracy and red tape attached to it. When I saw the application for the new model, I was stunned at the amount of paperwork that this was going to mean for frontline workers.
A coordinator with Toronto Overdose Prevention Society, Jillian Cola, is one of many astounded by the provincial government's decision.
This is callous. I mean, we have sites that were called at 3 p.m. and told, you have to close down by midnight on Sunday. And so I've just got off the phone with the operator about a life-saving healthcare site in Kensington Market who's been told on Sunday at midnight you have to shut down. And there's no transition plan for the dozens of clients who he keeps alive every day.
Mayor John Tory issuing this statement, it is disappointing that the process that led to this did not include consultation with public health officials about closing these sites. These sites all underwent extensive consultation and a lengthy approval process prior to their opening. Health Minister Christine Elliott saying this: our government takes the opioids crisis very seriously. The sites will continue to save lives by preventing overdoses and connecting people to primary care, treatment, rehabilitation, and other health and social services to ensure those struggling with drug addiction get the help they need. How exactly are these safe injection sites being impacted?
So what's being impacted is primarily the funding that they would be receiving from the province. That's one of the very, very big things. But I think the thing that is important to realize is that by cutting these services, people aren't just going to stop using drugs. So when you cut these type of services, what it means is that people will be injecting in places like Tim Hortons bathrooms and McDonald's bathrooms and parks and alleyways. And those are not places where we want people to be using.
The 15 approved sites already exist and will keep operating with funding extended until March 2020. The ones facing uncertainty include the works run by Toronto Public Health. It sees 3,000 visits each month.
The 2 smaller sites that are being impacted are St. Stephen's Community House and Street Health. Those are smaller programs. They run smaller sites that have 2 seats each. And in those places, St. Stephen's, it's within a drop-in that runs in the morning, and they see a lot of people with mental health challenges. There's no other sites in the area that are open in the mornings, and so they see a particular clientele. Street Health sees a lot of women. 60% of their users are women.
Licenses for these safe injection sites are set to expire on March 31st, but we do know that the works will remain open because they've been given a federal exemption. Maliha Sheikh, City News, Toronto.